matter, and your baby matters, and your family matters, and help people reflect on what changes they want to make in their life, and let them know that there's hope and that the community cares enough about them. We come from the approach that if we're going to make our community stronger, it starts on an individual level.
And so that's under the central nervous system as well. They also can have some GI issues, so they have a frantic suck, or they're looking around to try to suck on their pacifier, or they can have loose stools, watery stools. They can have sneezing or mild. Is different. If I hear it, I know it's a baby that has NAS versus a different baby, newborn that's crying. It's almost like they are shouting out in pain, because it's very high pitched, it's very shrill, and it's very intense.
If they suspect opiate exposure, then the babies are automatically watched for 5 days, and they're scored every 3 to 4 hours on the Finnegan scale, and those scores dictate how severe their withdrawal is. If their scores reach, every hospital has a slightly different protocol, but I think the ones around here typically use if they have 3 consecutive scores of 8 or greater, or 2 consecutive scores of 10 or greater, then they're started on some sort of pharmacologic treatment. So the most common one, the first line of defense there, is morphine. But usually hospitals try to pursue non-pharmacological treatment first, so dimming the lights, kind of a low stim situation. Sometimes they'll consult physical therapy, massage therapy. There's a lot of other kind of non-pharms that people are trying to reduce some of those symptoms.
The big issues surrounding NAS is the lack of awareness in the area. So part of it is that it's very well known in the hospital system, but once it leaves the hospital system, I think that it kind of gets forgotten about more.
But I really do think we have a big gap in the research of kind of long-term outcomes of what these kids and these infants look like. To work with a mom because it's their fault that they did this to their child, and that's not really what the case is anyway, right? They're addicted just like you are anything else. They've got neurotransmitter, neurochemical differences in their brain that are, making them crave this thing. It's not necessarily that they want to do this. They need mental health assistance to get through their addiction.
I can't believe what you did to your baby is definitely not the right way to handle it. Not using things like drug addict and, the baby's born addicted. They're not born addicted, they just have withdrawal symptoms. So talking about it in not such a negative way. Some of the things we can do as a community to help with NAS is to decrease stigma around it and talk openly about the consequences of NAS and the reason why the babies have the NAS in the first place.
The tagline is Love Restores, and that's really what we want to see is restoration. It doesn't have to be big. It doesn't have to feel big. It's like, but volunteering is huge, and just showing up for people is huge. I started at Families Free because I have been a teacher, and I was on leave for other reasons and wanted to volunteer in a community, in an agency that was helping families. And so I just started by volunteering a few hours a week and providing transportation. And just that, I mean, that just transportation is such a barrier in our area. And so having someone who would drive someone to group, who would take their baby to daycare so then they can attend treatment services, or driving them to apply for a job, or driving them to get for their WIC appointment. I mean, those seem really basic and they don't sound exciting, but those are real tangible things that actually make it possible for people to make changes. And rolls down from generation to generation, like a fire in the woods, taking down everything in its path until one person in one generation has the courage to turn and face the flames. That person brings peace to their ancestors and spares the children that follow. And so that's kind of how we view our role, is when someone is ready to turn around and face the flames, that we're there to help them do it.